We're going to take you live right now to Alberta, where Premier Danielle Smith and officials are addressing the E. coli outbreak at almost a dozen daycares, sickening hundreds of students.
No other child goes through what they are going through. This is my commitment to all of you. This situation remains very serious. However, we're somewhat heartened by the fact that it appears that the number of patients in hospital has stabilized over the last couple of days. As of today, a total of 337 lab-confirmed cases have been reported in connection with this E. coli outbreak. There are currently 12 patients receiving care in hospital. This is encouraging, as it's a decrease of 8 compared with 2 days ago. Lastly, 10 patients have hemolytic uremic syndrome, and 6 are receiving dialysis at Alberta Children's Hospital. We have also confirmed that there are 26 secondary transmission cases of this E. coli bacteria. This occurs when someone has contact with one of the patients directly linked to the outbreak. All are within households already linked to this outbreak. This relatively small number of secondary transmissions highlights the fact that the quick response to this outbreak and communication with families has helped to limit the spread. I do want to provide an update on one additional positive case of a child from Calgary who does not attend one of the implicated daycares. I became aware of this positive test result just last night. However, symptoms had begun in this child over the long weekend in September. Our staff are investigating a possible link to this outbreak, but there's no confirmation that it is directly linked at this point. Now, out of an abundance of caution, the affected area of the daycare that this child attends is being temporarily closed. I provide this information this morning just to give the clearest possible picture of this situation. It's also a reminder that it is sadly routine for us to see small numbers of E. coli cases each week, even in children. And it also highlights just how complex the investigation into this outbreak can be, as each case needs to be thoroughly followed up with linkages determined. It's important for it's important for parents to monitor their child for symptoms. If your child is sick, please keep them home. As parents, you know when they need to be seen by a healthcare professional. If you do not have a young child yourself, please remind your friends and your family who do. It is far better to be safe than sorry, and the actions that we take in these situations can make a huge difference. To parents dealing with sick children, I know how unsettling it can be to hear these statistics, knowing the potential impact on your child's health and well-being. I want to reassure you that we are on top of this and we are monitoring it very carefully. We anticipate that lab-confirmed cases of E. coli will continue to increase as test results come back, but we are cautiously hopeful that we won't see significantly more children with severe illness. I acknowledge, though, that this is of little relief to the parents of those children who remain in hospital. But it may suggest that while we're not completely out of the woods yet, we are beginning to see the health impacts of this outbreak start to wane just a bit. As some of you will be aware, the closure orders issued for all 11 daycare centers linked to this outbreak have now been rescinded following re-inspections by public health officers. These daycares have addressed the risks and they've met all the requirements under the Public Health Act related to sanitization and safe operations of their facilities. This includes, but isn't limited to, having supplies of all approved sanitization products in place, guidance for hand washing and sanitization available to all daycare staff, and guidance for food handling and service at each facility. In addition, children and staff from facilities with confirmed cases must meet certain requirements, including providing negative stool samples before they can return to a daycare. AHS has sent letters to all parents outlining these requirements and to provide advice and support. These requirements are designed to prevent further transmission, effectively preventing this bacteria from spreading. It's now up to the operators to decide if they are able and if they wish to reopen. Of course, the central kitchen that provided food to these 11 daycares remains indefinitely closed. I acknowledge that there is some concern that this kitchen was able to continue to operate despite public health inspectors identifying a number of violations, both critical and non-critical, at recent inspections. I understand that concern, but I can assure you that there were no delays or gaps in inspecting this facility. Every food handling facility in the province is inspected at least once a year. That is the standard and the requirement under legislation. In the case of this facility, it was inspected 5 times in 2023, directly related to the fact that violations had previously been identified. There were concerns about this facility, and our public health inspectors more than doubled their visits. The last routine inspection of the kitchen happened in late April 2023. 2 infractions were found at that time, and they were corrected by the end of the day by the operator. As of the end of April 2023, there were no violations outstanding in this kitchen. However, 3 critical violations were identified during the inspection on September the 5th. These critical violations were different than the violations that had been identified and previously remediated in April. It's important to note that under the Public Health Act, AHS does not have the ability to permanently close a food handling facility unless critical violations continue to exist. I certainly acknowledge that this is all cold comfort to the parents of children who fell ill. I am not trying to make excuses for this operator in any way, but the inspectors did their job under the Public Health Act. Finally, I do want to provide a quick update on the investigation into the cause of this outbreak. It is frustrating that we don't yet have a definitive answer on what made all of these children sick. But as I've mentioned before, this is an extremely complex investigation, and identifying the exact source and how things unfolded is like trying to find a needle amongst a field of haystacks. We know that the source is highly likely to have come from the central kitchen. In total, 45 food items from the kitchen and daycares have been collected to date, and we have received 19 results back from the lab. None have tested positive for E. coli. Additional results for the samples that are remaining are expected within the next few days. Our investigators continue to talk to patients, staff, and family members about what they ate, and a detailed analysis of the epidemiologic data is also providing us with further clues. We all want answers, and through a methodical, coordinated, and systematic approach, we hope that we'll be able to provide them just as soon as possible. To that end, this investigation continues. I wish to sum up by again expressing my thoughts and concerns to everyone impacted by this outbreak. My commitment to you is that we will continue to do everything within our power to help you or your loved ones recover and get better, and to do all that we can to ensure that this does not happen again. Thank you, and with that, I'd like to invite Premier Smith to the podium.
Thank you, Dr. Joffe. Good morning, everyone. I would like to thank Minister of Health Adriana LaGrange, Minister of Children and Family Services Cyril Turton, Dr. Mark Joffe, Chief Medical Officer of Health, Dr. Franco Rizzuti, Medical Officer of Health in the Calgary Zone, and Dr. Tanya Principe, who is the Section Chief for Pediatric Emergency Medicine at Alberta Children's Hospital, for joining me here today. I want to provide an update on the E. coli outbreak that has hurt so many kids. What's believed to have happened was a violation of food safety standards in a shared kitchen, and undoubtedly a violation of parents' faith in the system. When people entrust their child to someone else, they expect their child will receive the best possible care. Families are watching in anguish, watching their children suffer from a preventable cause. They're enduring extreme stress, afraid of what the outcome will be and how this will affect their child's health. It's unimaginable pain, and I'm heartbroken by what these families are going through. Right now, the most important comfort I can offer is the promise that each sick child is getting the best possible care. And I would just like to thank all of the medical professionals who have been doing everything they can to treat and to heal and to comfort these children and their families. I know that each affected family and all Albertans want to know what the root cause of the outbreak is. And so do we. At this time, the investigation, as you heard, is continuing, and I know that you will want more specific information and answers, but we must let the investigation continue methodically and safely. I assure you, we will get to the bottom of this, we will identify the cause, and we will put in place the necessary measures to ensure this does not happen again. I want to be clear, the kitchen believed to be responsible is closed indefinitely, as Dr. Joffe has said, and we will have more to say on this subject once the investigation is complete and we've reviewed the findings. And while the situation develops, I would like to explain how our government is supporting the families harmed by this horrific experience. Families are having a tough time with a lot of disruptions. Some have spent days and nights watching their children in pain in the hospital or sick at home. And we understand that this has put families under a lot of stress and a lot of financial stress. We want to help ease as much of that stress as we can, and that includes the financial strain this has caused due to parents being away from work and caring for their kids. To support all families and children affected by the outbreak in these child care facilities, families will receive a one-time compassionate payment of $2,000 per child. Our goal is to get the money to the parents as quickly as we can. We will be sending information on how to apply for assistance shortly. And while Alberta's government is providing this financial support, we expect that these child care facilities recognize the hardship that has been caused and reimburse families the fees for the days that children have been spent out of care. This incident obviously sparks worries about the well-being of kids in child care programs. It's our top priority. Ensuring uniformly high standards across the whole system is essential. Alberta's government will keep working closely with the programs hit by the outbreak as they reopen and return to full capacity. And we're working with other childcare operators to identify spaces in other centers for those families who want new placements for their children. Currently, all signs are pointing to this shared kitchen. I know parents want answers, and so do I. That's why we're conducting a review of all shared kitchens that serve childcare centers. We will explore regulations and make changes if needed. We will, as I said, if changes are needed to be made, we will make them. We are always ready to step in, and we will always respond to concerns. Families are not alone on this or any other issue. I'm so grateful to everyone involved in uncovering the truth and fixing the damage done to so many kids. This goes for the experts carrying out the investigation, the parents, and the incredible medical staff and the daycare workers who are now helping children at the affected centres get back into their routines. The love and care of all Albertans comes through very strong in the most difficult circumstances, and that's what we're seeing now. That's how we'll get through this. Thank you, and we'd be happy to take questions. As I mentioned, we do have officials from the Children's Hospital able and on.
Okay, we're listening live in Alberta, where they're getting an update from health officials and, of course, a very emotional Premier Danielle Smith there talking about the E. coli outbreak that sickened so many children there. You could see the Premier really choking up as she talked about the impact that was having and, again, promising to get to the bottom of that outbreak.